No one investigates like News 4. Families trying to care for elderly relatives face complicated choices.
But we've learned there's a 5-star rating system that can help you find a quality nursing home. News 4's Luke Moretti reports.
There are tough decisions to be made when deciding which nursing home is best for your loved one.
There are places that you and I would not want to be in.
Anyone who's been through the elder care minefield understands that not all nursing homes are created equal.
It's a hard job.
Anthony Siegel is a UB law professor who also supervises a clinic that works with legal services for the elderly.
Nursing homes have to operate every day of the year. They don't take Christmas off. They don't take, 4th of July off. Someone has to be there providing the right quality of care for quite a range of needs.
Nursing Home Compare, a website run by Medicare, tracks quality of care information on every Medicare and Medicaid certified nursing home in the country. Facilities are given an overall rating of 1 to 5 stars based on inspections, staffing, and quality.
And I would certainly encourage people to do that quick search before they make any kind of decisions about nursing homes.
A 1 or 2 star facility is likely very bad.
Richard Mollett is the executive director of the Long-Term Care Community Coalition, a consumer advocacy organization. He tells News 4 Investigates that nursing homes industry-wide tend to be understaffed.
We generally look to see, for nursing homes that are, and recommend that people look at nursing homes that are in the upper range of 4 to 5 star, and to be very concerned when there is especially 1 or 2 stars for nursing homes.
Madeline Huber is currently a resident of the new Terrace View long-term care facility on Grider Street, run by Erie County Medical Center Corporation. Previously, she had been residing at ECMC's skilled nursing facility, which is no longer in operation. Both facilities have been named in a notice of claim, the first step toward a possible civil lawsuit.
Our investigation showed that not only was Ms. Huber not receiving daily adequate care, but others were not as well.
Among the allegations in the claim, the facility failed to provide appropriate grooming and hygiene services, failed to provide a timely response to residents' needs, and failed to meet basic human needs.
If somebody's not provided the appropriate services, somebody is left with uncut food and unassisted in front of them, they're left cold, they're left on the toilet, they're going to the bathroom before they're able to be transferred to the toilet because they can't wait any longer. That relates directly to a resident's dignity.
Terrace View, according to Nursing Home Compare data, has an overall rating of 1 out of 5 stars, which is much below average. Erie County Medical Center Corporation declined to comment on the notice of claim, but did issue this statement. Terrace View is a vast improvement over the former facilities. We are disappointed that while our overall score improved, our star rating decreased. While this rating does not take into account all aspects of care at Terrace View, we take all inspections and ratings very seriously, and we always strive to improve the care we deliver. So what should you look for when deciding on a nursing home? Experts say it's important to know the needs of your loved one. Visit the facility. Talk with other residents and families. Find out if the facility has a specialty. Familiarize yourself with the financial issues and ask these questions. Do you have long-term care insurance? Can you afford to pay out of pocket? Is your loved one Medicaid eligible? Toby Laping is a geriatric care consultant who's been working in this field for 35 years. She says it could take months for Medicaid to approve a case and start the money flowing.
In the meantime, the facility has no money coming in for your loved one. So they would rather not take a patient, typically, with 1 or 2 months only of private pay than have a patient who is Medicaid approved. At least they'll know that they're going to get money from the first day.
The nursing home industry is big business, and despite how confusing it can be, payments drive the system. Think about this. It's estimated that the cost of private pay nursing home care in Western New York is anywhere between $8,000 and $13,000 a month per patient. According to a U.S. Census Bureau report, less than 1/5 of older people have the personal financial resources to live in a nursing home for more than 3 years, and nearly 2/3 cannot afford even 1 year. Medicare only pays for short-term care, no more than 100 days. Medicaid for low-income patients covers long-term care in certified facilities.
From the administrator's point of view at a nursing home, my first preference would be someone who could private pay for a while, obviously, because I can charge them more money. Secondly, I'd like someone who's already on Medicaid. Third would be someone who says, well, I can apply for Medicaid. I'm not on there yet.
Bottom line, people with limited upfront cash are generally left with fewer choices when it comes to nursing home placement. Once you have settled on a nursing home, there's the next hurdle. How do you get in the door?
The easiest way to get into a nursing home is from a hospital. And if one enters from a hospital to a nursing home for short-term rehabilitation.
Toby Lapine says there are other placement factors, like a patient's behavioral history.
Even a patient with money can have difficulty getting placed if the behaviors are too hard to manage.
Choosing the right nursing home is perhaps one of the most important decisions you'll make for a loved one in need of 24/7 care. There's a lot to consider, not the least of which involves the level of care being provided and the most important issue, the level of staffing.
The system certainly has its flaws, and it may not work the best for everybody, but there are some very high-quality homes out there and nursing home administrators that are doing their best to serve a lot of the population that we have in Erie County.
News 4 Investigates looked at 72 nursing homes in the Western New York region from federal records, and we have posted the information on WIVB.com. After analyzing the data from the Nursing Home Compare website, we discovered that more than half, 51%, are ranked average or lower. A third, or 33%, had an overall rating of 1 or 2 stars.
None of us are getting younger, and we may all need this type of assistance someday. And I think the hope is that we can place our trust in a facility that they will do what they promise to do.
Now, we have posted the nursing home rating information on WIVB.com. You can go to the site and search for facilities in Western New York using our interactive database. And by the way, that information was just updated today. Williamsville Suburban, which we profiled on Wake Up this morning, saw its overall rating go up from 1 to 2 stars. And you can see that report on WIVB.com. Luke Moretti, News 4.